Blood tests for Wegovy, which contains Semaglutide, and Zepbound, which contains Tirzepatide, are often over-ordered. Most patients do not need a giant monthly safety panel. Useful monitoring focuses on a few decisions. Establish relevant baseline results, watch glucose when other diabetes drugs can cause lows, and check kidney function after significant dehydration. More testing can create false alarms without making treatment safer. These medicines reduce appetite and slow stomach emptying. Nausea, vomiting, or diarrhea can then reduce both food and fluid intake. Dehydration lowers blood flow through the kidneys. Creatinine, a waste marker measured in blood, may rise when the kidneys are under that stress. That mechanism explains why kidney testing is driven by risk and symptoms. A stable patient who drinks normally may not need repeated kidney panels. Repeated vomiting, persistent diarrhea, dizziness, or reduced urination changes the situation. Kidney function and body salts may then need prompt checking. That same risk-based logic begins before the first dose. There is no single mandatory laboratory package for every adult. The baseline should reflect the person's medical history and current medicines. Blood sugar testing matters when diabetes or prediabetes is known or suspected. Kidney and liver tests are reasonable when prior disease, symptoms, or recent abnormal results make them relevant. A baseline does not always require fresh blood on the day treatment starts. Recent reliable results may already answer the question. Kidney reports often include an estimated filtration rate, which describes how well the kidneys clean blood. Later comparisons help separate a new problem from a long-standing abnormality. Some tests belong to routine obesity care rather than special drug monitoring. Cholesterol testing helps estimate heart risk, while urine protein can reveal early kidney damage. Their timing depends on the person's overall health and differs from glucose monitoring. An A1C test estimates average blood sugar over about 3 months. For someone with diabetes, it provides a starting point and tracks longer-term response. Testing about every 3 months fits medication changes or missed glucose goals. Stable patients meeting their goals may need it only twice yearly. That 3-month average cannot detect an immediate low. People using insulin or a sulfonylurea need closer glucose checks. A sulfonylurea is an older pill that pushes the pancreas to release insulin. Wegovy or Zepbound can lower glucose further, especially when food intake falls. Home readings guide whether insulin or the sulfonylurea dose needs reduction. Someone using neither insulin nor another medicine that forces insulin release usually has a much lower risk of dangerous low glucose. Routine finger sticks may add little in that situation. Symptoms still matter, especially sweating, shaking, confusion, or unusual weakness. Testing should match the actual risk. Kidney monitoring follows the same risk-based approach, especially during dose increases when stomach side effects can intensify. Mild nausea with normal drinking does not automatically require blood work. Ongoing vomiting with dizziness or little urine is different. Creatinine and electrolytes, the body's key salts, can reveal dehydration-related stress. That risk does not justify a broad monthly panel. Every test creates another chance for a harmless borderline result. It may trigger repeat blood draws, scans, referrals, and anxiety. Testing without a clear question can add medical activity without useful protection. Targeted repeat testing is different when kidney disease already exists. Older adults, people taking water pills, and anyone with previous dehydration may need earlier checks. These medicines do not usually injure kidneys directly. Fluid loss can overwhelm kidneys that already have less reserve. Liver tests follow the same targeted principle. Wegovy and Zepbound do not require monthly liver enzymes simply because treatment continues. Baseline testing may help when fatty liver, heavy alcohol use, or previous abnormalities are present. New yellow skin, dark urine, fever, or right upper abdominal pain requires evaluation. Those symptoms may also point toward gallbladder disease. Blood tests can show inflammation or blocked bile flow, but imaging often answers the main question. A normal liver panel does not exclude every gallbladder problem. The symptom pattern determines whether blood work, ultrasound, or urgent assessment is needed. Severe upper abdominal pain can also raise concern for pancreatitis, which means inflammation of the pancreas. The blood enzymes lipase and amylase may rise without true pancreatitis, so routine monthly checks can mislead. Persistent pain, especially when it reaches the back, makes those blood tests useful for diagnosis. Thyroid testing creates a separate monitoring question. A thyroid-stimulating hormone test, often called TSH, checks for an underactive or overactive thyroid. It is not required solely because someone uses these medicines. Symptoms and prior thyroid history should decide whether it belongs in the plan. A blood test matters when its result would change treatment. Routine calcitonin testing usually fails that standard. Calcitonin is a thyroid hormone linked with a rare thyroid cancer. Drug labels say routine calcitonin testing and thyroid ultrasound have uncertain value. A neck lump, lasting hoarseness, or trouble swallowing needs direct evaluation. Whatever test is ordered, context determines what the result means. A creatinine rise during vomiting differs from the same stable number recorded years earlier. The clinician should compare symptoms, previous results, dose timing, and other medicines. That comparison guides repeat testing, hydration treatment, imaging, or a medication change. The same logic guides a complete blood count, which measures red cells, white cells, and platelets. It is not standard monthly monitoring for either drug. Iron, vitamin B12, folate, and vitamin D tests also need a reason. Poor intake, hair loss, weight loss surgery, the diabetes drug metformin, or anemia can provide one. Pregnancy testing is also risk-based and may use urine or blood. It matters when pregnancy is possible, a period is late, or pregnancy symptoms appear. Treatment with Wegovy or Zepbound should stop when pregnancy is recognized. That result immediately changes treatment, giving the test a clear purpose. Several important checks never require a needle. Weight trend, blood pressure, pulse, hydration, bowel symptoms, food intake, and dose tolerance often guide treatment better than broad panels. Rapid glucose improvement can temporarily worsen existing diabetic eye disease, so some patients need eye follow-up. Normal laboratory results cannot replace those observations. Consider 2 patients on the same dose. One feels well, drinks normally, uses no insulin, and has stable kidney function. The other has repeated vomiting, takes a water pill, and produces little urine. Identical monthly testing ignores the first patient's low risk and the second patient's immediate danger. The first patient may need periodic diabetes care and routine health screening, not a special monthly drug panel. The second needs rapid kidney function and electrolyte testing, with treatment adjusted to the findings. Severe abdominal pain may require pancreatic, liver, or gallbladder evaluation. Symptoms decide the urgency and test selection. Use A1C for longer-term diabetes control and home glucose for immediate low glucose risk. Check kidney function and electrolytes after meaningful fluid loss. Reserve liver, pancreatic, thyroid, blood count, nutrient, and pregnancy tests for specific risks or symptoms that make the result actionable. Bring this monitoring list to your next visit. Ask which baseline results already exist, which medicines raise low glucose or dehydration risk, and which symptoms should trigger testing. Agree on what each result would change before ordering it. That plan keeps monitoring focused, practical, and safer than a routine monthly panel. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.